The story, the Western Cape Health Department has proposed the implementation of local COVID-19 restrictions as cases in the province continue to rise. The department has made recommendations to the provincial cabinet. To tell us more about this, we're joined now by provincial MEC for Health, Dr. Nomafrench Mbombo. Dr. Nomafrench, thanks a lot for joining us this evening. Surely you're concerned as the Western Cape government of the resurgence of cases as well as how people are responding to them.
Thank you very much, Faith. Yes, indeed, we are worried about the resurgence. Taking note, what are the landmarks in order for us to understand that indeed we do have the epidemic. The infection of healthcare workers is one indication, especially in the areas where we have seen quite large numbers of the positive cases. That is in the Garden Route. That includes the Beto, which is the Plettenberg Bay, the Mossel Bay, and the George area, and also in the Metro. Secondly, the increase in the hospitalization, which we have seen in terms of the number of the people who get hospitalized, especially the usage of the critical care beds, and also even the usage of the oxygen, and also the number of deaths. Because previously, when our numbers were decreasing around about in September, we found that the deaths were just one figure, but now you see that it's a double digit of the number of deaths. But most worrisome, it's about the positivity rate. At the time that we were approaching the first peak in early May, our positivity rate was about 16%, where we were worried. But now we see a positivity rate that is even above 20% overall for the province. And in some areas, we find that we even have got a positivity rate of even 30 or 40, just to show that indeed we are in the resurgence.
Yeah, I mean,
the last Friday, yesterday, actually the meeting we had in terms of a strategy, we're looking in terms of what is it beyond health, because when it comes to the health system, luckily enough, because of the lockdown, we managed to beef up in regard to the beds and also the health response. But what is it that we can do outside the health in order to manage the situation?
And let me come in here when it comes to that, MEC, because you're speaking about how do we go further than just implementing the health protocols. Now, there has been talks around localized restrictions being implemented. Are you indeed considering implementing these local restrictions, and exactly how will these local restrictions look like?
We don't have such powers, actually, because we are still operating under the Disaster Management Act. From the health perspective, we don't have those powers in terms of the restrictions. However, the Premier having conversations with the national counterparts, they could be able to assist in terms of imposing some. But in terms of the National Disasters Act, the restrictions can only impose at the national level. However, as a province, for example, just making an example, with a traffic cops where they could be able to stop at a certain road and ask for the people to show their license and all of those, it doesn't stop us to say in this particular area, how can we all come together, be it the Department of the Transport, the Department of the Local Government, and the Department of Health and others, where we say to the people, change their behavior. From this mall, wearing of the mask is compulsory. We will just zoom in and see how people behave and impose some of those restrictions that are within our powers, for example, in terms of the wearing of the mask.
Well, let's speak a little bit about the magnitude as well as the length of your influence over this, because it's very simple to go to, and I know that it can be a process, but to go to national, say, guys, the truth of the matter is the Western Cape is dealing with the resurgence of cases, and to be able to effectively mitigate against such, we need to be able to impose certain levels of restrictions, especially as we're heading into the festive season. Have you voiced that concern that actually in looking at intervening now and intervening effectively, there needs to be some kind of honing in on this COVID-19 virus? And if indeed you have, how have they responded to you?
Looking, for example, in the Eastern Cape, in the Nelson Mandela, that's where the resurgence has been the highest, because we find that it came to us after we have seen some of the parts, as I'm making an example of eNCA, there hasn't been any restrictions that have been imposed, but it was about looking at beyond in the health space, but going to the malls. I saw that the national minister even went there, even to the taxi rank, which is what we've been doing. So the issue about a lockdown, it is in the ambit of the presidency and also in terms of the advice from the local government and also from the national. But what we must also we must look at is about the behavioral change that even the law enforcement officers, such as whether it's a neighborhood watch or even the law enforcement officers, where you make use of the EPWP to be able to monitor, and also in terms of also our health promotions, our officers as health, where they could be able to assist in terms of spreading the message. I've been in the taxi rank throughout, where people were not even wearing masks, and then I indicated to the taxi operators that you shouldn't allow actually people to come in without a mask. Whilst we could be able to provide some masks in some of these areas where we visit, but there should be, each and every person has to take a responsibility. Same applies with the supermarket etiquette. Like yesterday, it was a Black Friday. When I was walking there looking at what is happening, I found that it was easy for the people when they just meet and then they take off their mask and then they hug and all of those. Yeah. No government could be able to police at that level. Hence, the individual responsibility is crucial, especially to protect our healthcare workers.
Just to intervene there, MEC, unfortunately, time is not on our side, but thanks a lot for joining us this evening. Western Cape Health MEC, Dr. Nomafrench Mbombo, on exactly what the province will be doing to mitigate against these increasing COVID-19 cases.